make decisions about us, that there's nothing about us without us that happens. And the number one way to do that is to stay connected. So I want to just say we have three very special guests today. Joining us a little bit later in the call will be Congressman Buddy Carter, who represents Georgia's 1st District, Savannah, and other counties along the coast and a little bit inland. We have State Representative Mary Robichaux, who's a great recovery champion for us in the Georgia General Assembly. And then in what will be the first of a series now, Neil wanted to get some reports from our recovery community organization leaders who are out in our communities across Georgia, so they can give everybody listening a firsthand report of what they're seeing in the real world on the ground in communities across Georgia. And we hope our stakeholders and the media that listen to these reports take special care to listen to these leaders as they talk about what's really happening in Georgia. And with that, I'll turn it over to our Executive Director, Neil Campbell.
Thanks, Jeff. I hope you're doing well this morning. I miss seeing my tribe for sure. So I want to start out by thanking, first of all, both William Carnes and Brian Kite, who are our producers. That's their production studio. You can see it just behind the scenes here. They're the ones who are making this happen. So we're really grateful for them. Thank you guys for doing this. And I'll introduce myself for those of you of the 68 people who are on the call right now who don't know who I am. And I'm sure there's more on Facebook streaming too. My name is Neil Campbell. I'm the Executive Director of the Georgia Council on Substance Abuse. I've been Executive Director going on 12 years, and it's my honor. I'm also a woman in long-term recovery. And for me, that means it's been 30 years since I've had my last drink or illegal drug. And I speak out about my recovery because I want everybody to have the opportunities that I've had to get and to stay well. And because of my recovery, I get to lead an amazing organization like the Georgia Council today. So I wanted to start by thinking about 30 years ago. For those of you who are 30 or older, you'll remember that. If you're not, you won't. So 30 years ago, I was part of a community of cyclists in Tallahassee, Florida. And we were an active group of pros, semi-pros, and wannabe pros. And I was in the latter group. I was a wannabe. You could say we were a cycling tribe. And during that period, my life ended up falling apart because of my long-term alcoholism and substance use disorders. And luckily, through the gift of having a friend in recovery, through God's grace and good health insurance, I got better. And that tribe remained, the cycling tribe remained with me. They called me when I didn't show up for rides. They fed me. They continued to support me all through my early recovery. They let me know that I was important to them. And I cannot ever go back and thank all of them because there was close to 50 of us. But I can't ever thank every single one of them for what they've done in my life. But I've had the opportunity to thank them in the past. So you can picture this tribe in my early recovery. And there's moments in your tribe that I think I'm going to ask you to identify in a little bit, but there's moments in your tribe that you'll never forget. I know there's moments in my tribe that I'll never forget. And in that cycling tribe, my most memorable moment was my 32nd birthday. So what I'd like you to do in the chat box, if you could say a few words about your most memorable birthday. I'm pretty sure everybody here on this call has had a birthday. What were you feeling? What was going on? How was that for you? I'm going to give you 30 seconds to write that box about what was your most memorable birthday. Could be when you were 6, could be a sweet 16. It could be when you're in your 60s and you get to celebrate for the first time. I know people that's happened with. So think about that. You got about 30 seconds. And let's see if I can. Brian, are we seeing anything in the chat box about most memorable birthdays?
Yeah, we had 18th surprise party. Jeff had one and he wrecked his car on his 16th birthday.
Memorable. What were you feeling? You were angry, upset, and what were you?
Oh, I was scared.
Surprise party, totally shocked. 36th birthday, first birthday in recovery.
Yes.
Birthday after he quit drinking. Oh, getting to see Hulk Hogan Slam Andre the Giant at WrestleMania.
Perfect. Anything else?
9 years old when got first home video gaming system. 12th birthday, dad made a dune buggy. Let's see, having all friends dress up as favorite things like Disney princess and Pokemon characters. 5th recovery birthday celebrated virtually. All right. 50th surprise party, surprised and humbled by the number of people who showed such care for me. We got a lot of folks.
Wonderful. Awesome, awesome. Thank you. Thinking about something. And Jeff's
You're really up. It looks like we have temporarily
I think we
Neil.
lost Neil. So Brian, let me say that we do have State Representative Mary Robichaux on the call now. So Brian, if you can unmute her. And
She is unmuted herself.
She's unmuted now. Before you begin, I just want to once again, for the folks that have logged on, thank you very publicly for your support and leadership for the Georgia recovery community in the Georgia General Assembly. You're a member of the working group on addiction and recovery, and we thank you for that. You've been very responsive and supportive, and we just thank you for your time today and welcome an update as you and the General Assembly see the world.
Good morning or good afternoon, everyone. I'm not sure can everyone hear me? Because my screen just went blank.
We can hear you.
Okay, well, so good afternoon, everyone. I think this is just so very important to keep people connected. We're all finding unique ways to try to stay connected. Within our Democratic caucus, we're having Zoom meetings. I have virtual town hall meetings. A lot of us we're doing this across the state, working together, and I know you do that also. As you probably all know, we're kind of like you, we and the state assembly had to go into actually, I guess we'd call it mandatory, or because of some exposure. Our last time down at the State House, we all went into self-isolation for the 14 days. I'm very happy to say I'm healthy. Most of us are. There were some cases that spread a little bit within the assembly members, but everyone is doing well. So that's a good thing, but it does point to we need to stay at home and stay healthy and work together. I know it can be a little challenging. My 14 days, my husband literally would not let me out of the house. So I guess I was lucky that I had someone to help me. I've now basically been in pretty much isolation for 5 weeks. I do go out a little bit with a mask, gloves when I have to. For those of you who may not know me, I do cover parts of Roswell and Alpharetta, but my background is healthcare management. I worked both clinical and actually in public health for over 35 years across the Southeast. I also have a family member who is actually a COVID ICU nurse, or actually she's a PA currently at one of the major health systems here in Atlanta. So again, it's staying home. I know it's hard. Staying connected as much as we can. You know, for those of us too, staying home, it doesn't mean, yes, you can go out and walk. I would probably say you don't need to go to beaches or things like that right now, but that's my own personal perspective. Again, just as an update from the state capitol, you may or may not know, we're basically in a suspended session now because of the public health emergency. So we have not been down to the state capitol since early April, and we will not be going back down there. I'm sorry, and until it is all clear. We did pass a 2020 amended budget. We are happy to say there was a lot of negotiation that went on between the State House and the governor's office, and that some of the what I would have called draconian cuts that were to occur in behavioral health and some of our other recovery programs, we did get those reinstated. We did not get, unfortunately, increases that we would have liked to have seen. The 2021 budget for the state we have not passed a budget yet. And again, for those of you who do not know this, as a state legislator, our one constitutional duty of our entire being an elected official is to pass a balanced budget. We are constitutionally mandated to pass a balanced budget. Having said that, we did have a 2021 budget that did pass out of the House. I'm going to be very honest with you. I did not vote for the budget because I saw way too many cuts in programs, such as in mental health and in other health areas that I felt were very important. You have to weigh the budget in its entirety, and I just was not happy with it. Having said that, that was also based on revenues that we would have expected. Again, we do know that the revenues are going to change. Where and how much of a drop we'll have, we're just getting some of that information now. So we have to be back in session before July 1, which is when the 2021 budget starts. So, you know, it's going to be an interesting time. Let's say that. Some of the stories we're hearing, there were some bills that were passed, some good, some bad, are passed between the houses. Probably because we'll be working so hard on the budget, a lot of that legislation, and I know some, Jeff and I have talked, we supported, that will probably have to start over again in January because we will have such a limited time to pass the budget. We, as state legislators, I think across the board, we're all here to work together to help you. I cover House District 48, as I said. If you have questions that I can help answer, Jeff and others know how to get a hold of me or contact your own state representative. Some of this has to do with, I know a lot of people are having financial anxiety. Some of that is coming out now, what you can be applying for, and we can help you walk through that. Some of those other resources. So we're just here to serve as resources. And if you need additional help, just let us know. And Jeff, I'm going to I'll send you some of the sites that you can post up for those people who might need information from anything from Small Business Administration loans and those can be now, remember, even if you are a private contractor or a gig worker, you can actually apply for an SBA loan or you can be applying for some unemployment benefits, which is very different than in the past. So everyone is trying to make things as best as we can. I know I'm asked a lot, and I don't know if anyone has questions for me, but I'm usually asked a lot that when is this going to be over? And I'm going to say from a public health clinical perspective, the data is going to have to drive us when this is over. You've seen Georgia has ramped up its testing a little bit, but remember, for a state of about 10 million people, we've only tested under 60,000 people have been tested. So we know we have to do more testing to really know where the pockets are and where they're trending and how do we manage this. You are going to start to see, unfortunately, in the next few days. So be prepared. The number of people hospitalized will go up. And in all probability, unfortunately, deaths in Georgia will go up. So we are trying to save as many lives as we can and do the best we all can. So we're here to help. I don't know if there's any questions for me or how do y'all want to manage this?
Neil, I think, is back with us. And do you have time to wait, or do you need to go to another meeting?
Sure, I can be online and but y'all can go ahead and do your program.
Okay.
And I'll go on mute. And if someone has a question for me, just let me know.
Yeah, we're going to have a time for questions. So if you
Okay.
can wait, we'll loop that in, and we'll turn it back over to Neil, who I think is back on. Maybe. Brian? Anybody? Brian, you're on mute.
Yep, be good.
Yep. Did we lose?
Go ahead, Neil.
I just asked if we lost Representative Robichaux? Or?
No, she's going to stay on the line and take questions when we do our question session later.
Oh, okay.
Barb, whatever you want. It's hard to hear you.
You guys hear me?
It's very spotty.
Very
Okay,
fine.
how about now? It's crazy. Sorry, guys.
A little bit better. All right.
Should I go tell my neighbors to get off of the line?
Yeah.
What do you think? Should I continue, Brian? I'm looking at my producer.
I think you're good to go. If you have the capability to send me the slides, then I could also do that as well. So
Okay. Let me try to share.
we want to, if in that time period, to make it a little easier on yours. If you want to already hear from Shonda, or if you want to continue with the slides, I'll leave that up to y'all's discretion.
What you think? Can you hear me? We good?
Yeah.
We can hear you.
All right, cool. All right, here we go, guys. We're gonna, so I talked about, when we were talking, I just want to say a little bit more about the tribe because I want to challenge you to something to, okay? So when we think about me 30 years ago in my cycling tribe, my 32nd birthday, when they all sang, we were in a pace line just like this, and they sang me happy birthday. I never felt so loved, so supported, so included in my life. And today, close, but something that I remember for me.
Yeah, Neil, unfortunately, we're having a lot of issues right now. I don't know if we're going to be able to see your slides.
So Brian, why don't we let you and Neil text or something? And Shonda, if you are available, I'm going to lead you in here over the next minute. If you can, Brian, unmute her. And we'll let William and Brian help Neil. And so Shonda Santana, I can't imagine there's anybody on this call that doesn't know her, but if you don't know her, she's a true rock star and a hero and a leader. And she runs Divas Who Win based out of Athens. And I always like to think of myself as an honorary diva, just because it makes me feel good about life. But all jokes aside, she has been through a lot. She has the moral authority to lead in a very special way. And we did ask her to be our inaugural RCO leader to come on and give us that on the ground report. What are we seeing in the real world in real Georgia? And so Shonda, if you want to share with us, we'd all be thankful to hear from you.
Well, absolutely. Well, first of all, thank Georgia Council on Substance Abuse, Jeff and Neil, for inviting me to the call today. So I am the founder and executive director of Divas Who Win Freedom Center, and we are an RCO here in Athens, Georgia. And our mission is to support women who are overcoming substance use disorder, coming out of the sex trade, prostitution, or sex trafficking survivors. And with that, our mission was formed out of my lived experience. I am a woman in long-term recovery, and for me, my journey started about 23 years ago when I came out of the sex trade. 13 and a half years ago, I put down all substances and alcohol. And 3 years ago, had a teen daughter rescued from a family of sex traffickers. So that makes up the mission, and that gives you a little bit of an idea of who we serve here at our center. So Jeff, for us, with that caveat, for us, what we've seen, so Athens was one of the first counties to shelter in place before Governor Kemp made that requirement. I believe it was around March 10th, somewhere in that area. So what that caused for us, when we were accustomed to seeing the faces of 150 to 200 different women each month in our building, with somewhere upwards of 800 to 1,000 interactions monthly, most of the women who come here to Divas are living in the recovery homes here in Athens, and we have 4. So their places of residence also made a mandatory shelter and stay at the same time. So they were no longer allowed to even come here. And we are, essential services. So what that caused for us, what we realized when we did our data at the end of last month, our assertive phone coaching was over 400 individual check-ins with our peers over the phone or social media and text. So that's been about the most liberty that we've been able to have in terms of connection with peers is via telephone. And also we moved about 8 meetings to, like everyone else, Zoom and, the virtual scene. So one thing that we noticed, our team, we discussed this morning, because of our relationships with treatment centers and recovery homes, we've been able to leverage that a little bit. What's happened, some of our peers have really been impacted negatively by COVID and have found themselves in setbacks. And so because of such assertive, maybe even aggressive, loving phone coaching, we're able to get that information relatively quickly, and our peers are seeking treatment faster, it seems, if I were to base that on the types of calls that we've had in the last 6 months or so. So we've been able to tie those relationships with treatment providers into the phone line with our peers and try to provide transportation to treatment or stay in the loop to know who's even allowing for treatment right now with COVID. Should I continue, Jeff, or do you have another question? Uh-oh, I can't hear you.
Oh, shoot.
Okay, there you go.
Mute,
Nope.
so sorry.
Okay.
No, that's a wonderful update. And if you can stay on the line too, I'm sure people will have questions, and we'll let you hop in during that time too. I think Neil is back. I will give everybody a heads up that Congressman Carter's staff has texted me, and they are looking to be on right at 12:30. So we're about 7 minutes out from Congressman Carter. And Brian, I'll turn it back over to you and Neil.
And if Neil's ready to talk, she can, are you?
Am I on mute?
You are unmuted.
Golly, you guys, I've never had so much trouble with this. What's wrong today? It's weird. Usually we're...
I would suggest if you have the capability to send me the slides via email, and maybe in the midst of that, because sometimes it might be too much for your internet connection to share both your screen and talk at the same time.
All right, let's...
But perhaps we can maybe take a few questions while we're waiting for that to happen. If anyone has any questions for Mary Robichaud or Shonda Santana, if you would use your virtual hand raising or write in the chat. Let's see, we do have a question from Cam Parks. Does anyone have any knowledge on who is taking people in right now for long-term treatment? I did have some information from a few people. We got a yes from Patty Collins down in Jessup, Georgia. Patty, if you would be able to share any information that you have in the chat with Cam, feel free. I don't know if Shonda if she has any knowledge in the Athens area on that situation.
So, so when they say long-term treatment, if that includes recovery residences, we've had the most success with Sober Living America. They are still currently, that was a week ago, we took someone over the weekend. So you don't have to have money, but that's a recovery residence / halfway house. And then the CSUs, even Advantage, were able to get someone into the ITP program here once they went through detox in the CSU first. So Advantage Behavioral Health Services is still up and going in their 10 county spread.
Thank you, Shonda. And I see we got some additional information here in the chat. So thank you, everyone that's providing some of that info.
And Brian, this is Representative Robichaud. The State Department of Behavioral Health is trying to get together a list. and keep it as active as we can. And it may come under the area of Department of Community Health, because they have some up and websites where people can go for some information on different types of healthcare services available around the state. But I'm not going to say it's 100% accurate.
Thank you, Representative. Any other additional information? I know that I think that there was some concern from someone I know had asked about the CSUs, some of them closing, but that was due to an outbreak occurrence. And I don't think that that's a regular thing. I think that they're trying to maintain operational status. We have another question. Are ARSC or RCO a priority for testing as active soon-to-be health providers? It's going to be a recurring question there. I don't have any information or knowledge on that to address that. I think as anyone, as the testing is limited across the state, I think a priority is just going to individuals that currently have experiencing circumstances or a high risk situation. I understand that a health provider would be high risk, but
So again, Brian, not to interrupt, there are going to be some new testing coming out, testing capabilities. There's a, at the state level, again, it's been in conjunction with UGA, Emory, some of the institutions, and the State Department to expand out. It will be, some will be the rapid test. It is still right now, we're hoping within the next week, it'll open up a little bit and not just healthcare providers directly associated with treatment of COVID patients, the elderly, and those that are showing severe symptoms once they get to the hospital. We need to test more. So the state is working very hard on that with partners. So again, Jeff or others, I can post when we get more information of availability, and some of the county health departments will be involved in that, as will the federally health care qualified units around the state. So you still, right now, you must have a physician's order to get any of this testing done.
thank you very much. It looks like that definitely answered that question.
So,
Questions? I think we're still waiting for Congressman Buddy Carter to arrive to share as well.
and I think Neil is back.
Yeah, but my internet's just so unstable, y'all. I'm so sorry. It's good to see your faces, though. We'll do the presentation some other time, or you can listen to my TED Talk. Just kidding. Still working on that.
All right, so yeah, we're, it's about 1 minute till he calls in, so we need to fill a minute or a minute or two, so before we start a presentation. But anybody else got a question?
Hey, yes. I have a little story, Jeff. Can you hear me, or am I wobbly?
We can hear you right in a second.
I've been asking our coaches at the hospital, for some stories of hope, because to me, this is getting old, y'all. I'm just so tired of this, but this sheltering in place thing. And I was told that we had a person who came into the hospital for an overdose and was connected virtually to one of our coaches, and was going to sign on that night for an all recovery meeting. And so we were all sort of holding our breath to see if he would, and he did. So got the beginning of his long-term recovery for himself, and that is amazing. So recovery is happening even in this thing, in this stay-at-home, shelter-in-place, quarantine world we're living in. So just please don't forget that. And I challenge all of us to think outside our boxes that we normally do, and to reach out, keep reaching out, and it's going to be okay. And Jeff?
Neil, that's so true. And one of the things that Neil did was she instituted these virtual all recovery meetings, and, yet again, leading the way really across the state and arguably the nation And we've had, I've lost count of how many we've had, but we've had close to 30 at least. Brian is probably better at the math than me. And I know over 1,000 people. And what's really touching is some of our new friends who have come to know us through those meetings are on this call right now.
Yeah.
We've been inviting them to come. And I know, I don't want to say who they are, but I know I've seen them in the screen. And it's just such a wonderful thing that even with the challenge of COVID-19, our community is finding ways to stay connected. And we're getting to know new people. And I just think that's a wonderful testimony to the power of recovery. And frankly, to Neil's leadership to let these things happen.
Jeff, just to let you know, Congressman Buddy Carter is on the call and is.
Well, excellent. Well, Congressman Carter, we want to thank you for being on the call. I want to tell you before I forget that we do have constituents of yours. That's his staff. I did turn it on for that, Brian. We do have constituents of yours on this call, Congressman. I want to introduce one of them. Bonnie is on the call from Savannah, and she's working with Brian and Emily and Jean on our team to get a formal recovery community organization started in your district in Savannah. You of course have visited face-to-face in Jessup, and I know they are on the phone too, or on this call too. But I want the people to know that you have gone out of your way, both legislatively and as a person. You came up to Atlanta from your district and came to our offices and spent time getting to know our staff and understanding our operations. And I don't know if we can ever fully express to you what that meant to us as a team and to our community, but your work is tireless for recovery. And I want to turn the floor over to you and say thank you for being here and just ask you to share with us. We are all concerned about phase 4 and phase 5, and we're hoping that there's funding for recovery in those phases. And we thank you for your time.
Hey guys, Matthew Orr with Congressman Carter's staff. Just give us a couple more minutes. The Congressman's finishing up his last call. Just be patient. One moment, please.
Thanks, Matthew. So
So
Jeff,
Matthew's going to go out to tell the Congressman every nice thing we just said about him.
and I will say one more nice thing is that we put out the invitation to the entire Georgia congressional delegation to come and visit our offices. And we have, we've had some responses. We had 2 that actually came. And one was that Representative Lucy McBath, who was on our call 2 weeks ago, and Representative Carter came as well. So that really means something to us when people show up. That's part of being in the tribe. He's officially in our tribe, whether he wants to be or not now, because he shows up for us. And that's amazing. And he stayed and he listened and he learned, and we learned from him. So that's called relationship building. And we should all be doing that with our state reps and our United States congressmen and our United States senators. We should be doing that because we're in it together, and it's a we thing. So really appreciate, so everybody knows we are always inviting our Georgia delegation to come see us.
And we may or may not have a special guest next Wednesday. We are discussing it with that member's staff, and we hope that their schedule allows. And that's good news, because if you think about it, now members of our congressional delegation are hearing that these are a place they want to be a part of. And this is a community that they want to be in touch with. And so we are thankful, and it's because of nothing about us without us. And I just got a text that he's finished. I should have known, having worked up there for a long time, that, their time and our time are not always the same, but they are finishing up. Neil, maybe with your permission, in the interest of time, I'll just talk a little bit about advocacy real quick.
Yep.
And
Go for it.
Brian and I will both monitor the congressman popping on. But I'll say that last night I was on a town hall with 10 members of Congress. And it was great. And I got to ask a question about funding for the recovery community in phase 4 and phase 5. And that was going to be transmitted to 50 members of Congress who are part of this caucus. So when I say get on a virtual town hall meeting and type in that question or ask that question, y'all, members are listening, their staff is listening, and this is our time. It's our time to use this technology to put our message forward. we are moving forward with 3 outreaches that Neil has approved, and over the next several days, we'll be asking the Georgia recovery community to send a series of emails and phone calls to people like Mary in the General Assembly with 3 specific concerns and needs that we have as they get ready for the 2021 budget. It is just essential that we make sure they know that our constituency is a constituency that is directly impacted by COVID-19. And as Neil has articulated several times publicly, what's about to happen to Georgia as a result of COVID-19 as it impacts mental health and substance use disorder is going to be staggering. And we need the state and our counties and our cities and Congress to be ready for funding for that. So we'll also be working with our congressional delegation on that same thing. We are going to be launching a series of virtual advocacy trainings that will be about a half-hour session. Those should start next week. And the last little update I had, Neil, was we are in the process of working with Bianca on our staff and Larissa and William, and they are putting together the stuff right now where we can soon launch a virtual all recovery meeting in Spanish to serve our friends in Georgia whose primary language is Spanish. It's a tremendous undertaking that we're doing, and we are so excited to be able to launch that in the immediate future. So that was some of the advocacy stuff. I had a short report, but trying to kill some time now while he's on the call. And there he is. So there's Congressman Buddy Carter. I know you're busy, Congressman. I do want to say, Congressman, we have constituents from Jessup and Savannah on this call.
Oh, good.
And they are either face-to-face where you've been, and Bonnie is working with a group of people in Savannah to start an RCO in Savannah, and we'll be asking you to be part of that. But just thank you for your time and your leadership, and we turn the floor over to you.
Well, thank you. I apologize for being a few minutes late, but thank you for giving me this opportunity. And what I thought I'd do is very quickly just kind of review what we've done in Congress, talk about a potential phase 4, phase 5, whatever it may be, what might be included in that. And then, of course, talk about some of the mental health part of it and some of the addictive services that we've included in it. And then, of course, questions. But just to give you an overview, a very quick overview of what we've done thus far, we've passed 3 phases of the coronavirus relief package. The first phase had to do with making sure we were getting the test developed, making sure that we were getting money to the NIH, the National Institutes of Health, and the CDC to do research and development on a vaccination. The second phase had to do with making sure that those tests were going to be available to people without them having to pay for it, making sure that people were going to get family leave, sick leave, and then employers were going to get a tax credit to offset that. And it included some on telehealth. The third phase, the most recent phase, the CARES Act, of course, was the $2.2 trillion that we passed. And oh, by the way, that's the first time I've ever voted on a bill that had a T after the dollar mark. And I think the president also mentioned that that's the first time he'd ever signed a bill that had a T after the dollar mark. But it's needed. And I will be quite honest with you, I'm very pleased thus far the way that the CARES Act is working. And people have asked me before, at this point, I voted for all 3 of those relief packages. And if I had to do it again, I'd vote for them again because they are needed. Look, what we're going through is nobody's fault. This is so different from 08 and 09 where we had bad business practices that ended up and we had to bail out companies. This is not that at all. This is something that's beyond anyone's control. This is something that none of us can take responsibility for. This is an invisible enemy that we're fighting here. So we wanted to make sure in the CARES Act, we wanted to make sure that we kept people fluid. We wanted to make sure we kept them liquid. That if I had to describe the CARES Act in one word, it would be liquidity. We wanted to make sure, first of all, that we got a stimulus check out to each individual. $1,200 for head of household, $1,200 for the spouse, $500 for dependents. I hope that most of you or a lot of you have already gotten that money. I know that I checked with my staff this morning and many of them had it deposited in their account yesterday. And that's very important. because when we passed the CARES Act, we made it clear to the agencies. We said, we are intentionally making this legislation loose, if you will. We're not putting a lot of rules and regulations in there. Yes, we expect for you to guard against fraud, waste, and abuse, and we expect you to be efficient, but even more so, we expect for you to get that money out quickly. So that's why we didn't put a lot of rules and regulations in it. We left it up to the agencies. Now, there was a lot to address small businesses, and we made sure that we did that. The PPP, the Payroll Protection Program, which a month ago did not even exist, a brand new program. Yes, it's had some bumps in the road, it's had some bottlenecks, but I'll tell you, for a brand new program, it has worked exceptionally well. In fact, we appropriated $350 billion to that one program already as of yesterday morning. Now, I haven't gotten this morning's figures yet, but as of yesterday morning, Secretary Mnuchin told us on a conference call yesterday afternoon that $240 billion had already been out the door. Over 1 million small businesses had received that help in the PPP. That's very important. Now the administration is coming back to us saying, we need more help. We need more money for that particular program. And we're going to do that. The Senate tried to do it last Friday. Unfortunately, it got caught up into politics. It's going to happen. I just don't know when it's going to happen. I do think it will happen separately from a phase 4. I don't think it'll be, and I hope it won't be bundled into a phase 4. I hope that it'll be a 3.1, if you will, just so that we can just concentrate on improving those programs in the CARES Act that we've already set up. There were other programs for the Small Business Administration as well that we put more money into. There's another program called the EIDL, the Economic Injury Disaster Loan. The administration has told us, look, we're going to need more money for that too. We don't have enough money in it right now. So we're going to put more money into that. Now, the CARES Act also addressed telehealth. It addressed telehealth and telemedicine. Now, one of the silver linings, if you will, throughout all this, and there are quite a few silver linings, but one of them is telehealth. I'm in the Doctors Caucus. As a pharmacist, I'm a member of the Doctors Caucus. And we've been pushing telehealth, and we've known, and I serve on the Energy and Commerce Health Subcommittee as well, we've known that telemedicine and telehealth is something that we are going to have to do and do in the near future. However, what has happened here through this pandemic has been that it has accelerated that. Now we are really using telehealth, and it's the best time in the world to use it. You don't want people in emergency rooms now. You don't want people congregating in doctor's offices now. Anything that we can take care of via FaceTime or through telehealth, that's what we want during this pandemic. And that's, as I say, that's a good thing. That's something that has been a result of this pandemic, that otherwise telehealth would probably just be kind of lingering along, and eventually we'll get to it. But now it's here. Now what we're faced with is really addressing exactly what's included in it. I've been getting calls from the home health agencies saying, you know, we need to be doing some of these services through telehealth, and that would be good too. I've actually got a bill that I'm working on, that I'm co-sponsor, I'm the Republican lead sponsor, along with Representative Jan Schakowsky, who is the chair of the of one of the subcommittees that I serve on. We are trying to make it to where it will be permanent, and we'll get that passed. I don't know that it'll be in a phase 4, but we will get that passed. But I tell you about telehealth because it's very important. It included in this CARES Act, it included mental health services as well, and addiction services. So that's a good thing. That's something that substance abuse services, that's something that we needed to do, and something that came out as a result of this CARES. So we know where we're at with 3.0. Is there going to be a 4.0, possibly even a 5.0? I suspect there will be. It looks as if we will have a 4.0. What will it look like? What will be included in it? That's hard to determine. I refer to a lot of what we've learned through this as being nuances. There'll be a lot of nuances that we address in that, just like what I mentioned a second ago about telehealth and home health services. That's what I refer to as a nuance, something that we really didn't see and really couldn't have seen when we were putting all this together, when we were putting the CARES Act together. So there have been a lot of things that we need to address in 4.0. Now, I will tell you this, two things. First of all, if there is a 4.0, and again, I suspect there will be, if there is a 4.0 and it has to do with the physical health of our country, in other words, if we need something more for tests, vaccinations, or whatever, that'll be included. I'm very confident that'll be included. There has been some talk, some chatter, if you will, that obviously we need to worry about the economic health of our country as well. And we do. We have to, as government officials, it's incumbent upon us and our responsibility to pay attention to that. What we are hoping is that we're going to experience a V-shaped rebound. The economy went down. We hope it's going to go back up just as quickly. Now, that may be a little naive on our part, but one thing that's been mentioned is how can you help that economic rebound? How can you help to make it a V-shaped rebound? One of the things that has been suggested is infrastructure. Now, keep in mind, this is something that we've been wanting to do and that the administration's been wanting to do, that Republicans have been wanting to do, that Democrats have been wanting to do. This is not a partisan issue. Infrastructure impacts all of us. Now, one thing you have to keep in mind is that if we were to ask everyone who's with us now on this platform, if we were to ask you to define infrastructure, we'd probably get that many different definitions of what infrastructure is. Obviously, bridges and roads. Yeah, that's infrastructure. But what else does infrastructure entail? Well, in my mind, first of all, representing the entire coast of Georgia, where we have two major seaports, the harbors, the seaports, that's infrastructure. I also have a lot of rural areas in my district, a lot of rural areas that need broadband, rural broadband, high-speed internet. That to me is infrastructure as well. So I see that as being a potential part of the phase 4 to help us with our economic rebound and to do something that we've all Republicans, Democrats, leadership, everybody has been wanting to do, and that is infrastructure. That could possibly be a part of it. I'm not committing to that I'll vote for it yet. I am saying I will strongly consider it, and I think it is something we should consider in a phase 4. Now, just to be more specific about substance abuse and the mental health, yeah, we were able to get telehealth services in Medicare, telehealth services covered by Medicare for mental health services and for substance abuse services. That was very important in the CARES Act. Also in the CARES Act, we were able to get the treatment of substance use disorder medical records and HIPAA. That was something we needed to get aligned, and we were able to do that, and that was very important as well. And the reason why I mention these things is because having telehealth for mental health and for substance abuse, having the alignment of the HIPAA laws and what we're trying to do here in mental health and particularly in substance use disorders, whereas in the CARES Act, it's not permanent, it's only during the course of the pandemic, but it allows us to see how it works, to see how important it is, and possibly, and I will go as far as to say probably, gives us the springboard, if you will, to do something permanently. So that's where it's really a benefit for us. I see all of this as a benefit for us. One of the other things I wanted to mention is that we were able to provide $425 million to SAMHSA, and that was very important during this time. These are grants that, as you know, will address mental health and substance abuse disorders in the local community. So that was very important as well. We also reauthorized the Excellence in Mental Health demonstration programs. That was very important. We were able to get that in the CARES Act as well. So all of those things are good. And as I say, don't downplay the importance of something like telehealth, of something like realigning our HIPAA laws with what we're trying to do in substance abuse and these disorders. Don't downplay just that, oh, it's only during this crisis. Yes, that is what we addressed in CARES, but again, it gives us the opportunity to go back and say, hey, look, we've been talking about these things. And now we see just how vital they are. Let's take action on them. And let's try to see if we can't incorporate them in a permanent fashion. So all of those things I wanted to bring up to your attention and tell you that before I take questions, just tell you about a couple of bills that that right now I'm sponsoring. Unfortunately, one of the things that we find during a pandemic like this and during a disaster is a lot of scams. And we know that's happening. And when I say scams, I include price gouging, because in my mind, price gouging is a scam as well. What we have done is I'm right now sponsoring on the lead Republican sponsor on a bill that's called the Pandemic Scams Act. And what it will do is that it would require the FTC, the Federal Trade Commission, and HHS, Health and Human Services, to disseminate information about these scams, about telemarketers who are and people on the telemarketers who are calling, and people on the internet who are selling defective tests that don't really work. They're selling defective PPE, personal protection equipment that is not satisfactory and will not work as well. We've got all kinds of scams taking place. And what this bill does is that it directs those agencies to disseminate that information, however they may do it, through public service announcements or through the internet, to get the information out there and let people know about these scams. And it says that they have to do it ASAP, as soon as possible, get it out there. It also says they have to create a website that people can go to, read about these scams, and that website will be user-friendly so that people can actually enter their own experiences in there. Perhaps they've experienced a scam and they'll be able to enter it on that website as well. The last thing I'll mention is another piece of legislation that we're working on in our office. I suspect some of you are around my age, and you can remember back to the late 70s when we discovered that we were too dependent on the Middle East for our oil, for our energy needs, and that we needed to have energy independence, and we did that. Well, one thing that we've discovered through this pandemic is that we're too dependent on other countries, i.e. China, for our pharmaceutical needs, and we need pharmaceutical independence. 90% of the antibiotics that we're using here in America, 90% of the antibiotics, of the ibuprofen, and of many vitamins come from China. That is not a good position for us to be in. We need pharmaceutical independence. So we're sponsoring legislation that will try to repatriate some of these pharmaceutical manufacturers to come back to America. We're trying to offer them incentives, inducements to come back to America so that we're not as dependent on other countries like China and also India. India provides 18% of all the generics in the world. And most of the active pharmaceutical ingredients that India uses in those generics, they get from China. So this is just not a good position for us to be in. So if we don't address this, shame on us. And I'm confident that we will address this. I think this is going to be a high-profile situation and a high-profile piece of legislation that we can get through. So I'm excited about that. And I think it's something that's very necessary. In a nutshell, that's it. And I'll be glad to try to answer any questions you might have.
Congressman, thank you, sir, very much. I know there's going to be a lot of questions. Brian will help navigate those questions if you'll raise your virtual hand or send Brian a message on the chat. But Congressman, I'll take the privilege of asking the first question. Before this began, the Georgia Council on Substance Abuse has been asking our delegation in Washington to support, and your office should have stuff on this, HR 2466, the State Opioid Response Grant Authorization. It's by David Trone from Maryland. It's got bipartisan Republican co-sponsors. And it basically authorizes the SOAR and TOR grants for 5 years because there's no underlying legislation authorization to do so. And so one thing the recovery community is hopeful for is that leaders like you who care about our issue will work with the current co-sponsors and make sure this current funding that funds these RCOs around the nation is not overlooked in phase 4 and phase 5. It is a especially critical time to make sure that the recovery community knows that at least the current level of funding is to be there moving forward. if not an expansion. And I'd ask you to take a good look at that if you would consider HR 2466. And that would mean a lot to our community. The last thing I would tell you is we are always working on the Parity Act to make sure that Congress provides language to the insurance universe that they have to enforce that piece of legislation already passed by Congress. It's just critical to our community that enforcement occur. So those are two big asks. I will thank you for your consideration and yield the floor.
Great. Well, thank you. And we certainly will look at those pieces of legislation. If we're not already on them, I hope that we're on David's bill, because he and I have talked about that numerous times, but I'll double check.
Thank you for that, Congressman. I did not see you on the public list.
Okay.
That doesn't mean the list is accurate on the website, but I appreciate you looking.
Yeah. He's a freshman, and he's really stepped up to take a lot of responsibility on a lot of these type of bills. So been really pleased with him.
Yes, sir, very much so. He met with a group of us from Georgia up there in Washington, and he's doing a great job with about 70 members who are focused on addiction and recovery, who are all freshmen.
Right.
So we had one question just in relation to the pharmaceutical legislation, asking if there was a name for that bill yet.
We have not named it yet. We're working with some of the Senate offices. We're trying to work with Senator Marco Rubio on this piece of legislation. So we're still kind of in the early stages. I'll be quite honest with you. I don't want to mandate that those pharmaceutical companies come back here. And, that's not the way I want to handle it. I'd rather incentivize them and maybe appeal to their patriotism to help them to understand we need this back over here. And keep in mind, and somebody else brought this to my attention, and I think it is important. We don't want all the pharmaceutical companies back here, because if something were to happen here, we just need diversity. We need to make sure that we're not depending on something. That China actually made overtures that some of the pharmaceuticals that they were making over there, that they were going to treat their own people first, and then if anything was left, then they'd send it to outside the country. Well, I get that, but at the same time, that's not good for us. And that shows you that just how important this is that we address this situation. But we don't have a name for it yet, but we will.
Thank you, sir. Neil was going to jump in. I think she wanted to. Oops. Sorry, we're playing. Go ahead, Neil.
That's okay. Jeff asked it. Jeff had asked a question about the parity, or talked about the Parity Act. That was my question.
Okay, great.
Yeah.
Well, Jeff, if there's anything else, I know we're pushing close to 1 o'clock now. Is there any other questions from anyone? If you would, write it in the chat option, or please raise your virtual hand so that we can give you the opportunity to share. We have a lot of thanks to everyone that shared, and especially Congressman Buddy Carter. That was a lot of great information that, it was definitely important for all of us to hear the great work that y'all are doing to push things forward for us during these times.
Well, thank you. Yes, sir.
I was just going to say, this is Jeff Breedlove. We talked about the possibility pre-COVID of you hosting a town hall meeting in Savannah about recovery. And we will be just so thankful that when it's safe to do so again at the appropriate time, we will ask you to do so. The Savannah is just such an important part of Georgia. Your district is so key to Georgia. And that would be a great way to come out of this, is to have somebody like yourself bring this front and center to our state when this is over. So I'll just remind you of that ask, and we hope that that's something we can do in the very near future. And we thank you.
I look forward to that. Thank you.
Thank you, sir. So Neil, I'm gonna say thank you to everybody. We'll be doing this next Wednesday at 12 noon. We know a couple of guests already confirmed, and we think we may have another member of the delegation from Washington on, we hope. And I want to turn it back over to Neil and remind you, as I do, of our virtual town hall meetings. There'll be one tonight at 7. And if you have not been on one, feel free to join. Neil, thank you for everything.
Yeah, thank you all. We appreciate you. And remember, yeah, next week on the 22nd from noon to 1, and then this Thursday, April 16th at 7, Representative Eric Allen is going to have a town hall, a Facebook community conversation about wellness. So you can look up Rep. Allen at allenforgeorgia.com. You can submit questions beforehand for him. That's going to be important. Both Representative Roz Hayes from the Mental Health Consumer Network and myself and Jeff will be on that. So we look forward to seeing you then. And sorry about the technical difficulties, but what another great opportunity for us to all connect during this tough time. Everybody stay safe and stay well, and we'll see you next week.
Thank you.
Thanks, Representative Carter.
Thank you.